Good morning, everybody. It's Nate Tate with Benefits by Design. I've had a really good last week in terms of Medicare. I helped people save over $200,000 on Medicare prescriptions. And I'm going to share how it's done, but if you or somebody you know is on Medicare, then they need to do their annual review. You don't have to raise the topic with them. If you just share this video, it'll probably get their attention. For the record, also, I got permission to share these stories. So, how did I save people over $200,000 on medications? Well, the first thing I do on all my Medicare reviews is I run my clients' medications through a pricing tool. Now that analyzes their medication costs according to every single plan that's available to them, and it also takes into account their monthly premiums. Now, on one client, I noticed a particular medication would be around $1,500 a month. And as I learned a little bit more about that, I asked him to go talk to his doctor, and his doctor informed him that he could actually get that medication as a monthly injection at the doctor's office. Now what this did was, even though it's the same medication, by getting it injected at the doctor's office by a nurse, it was now charged under his medical, not under his prescription plan. And so he was proceeding to save about 12 months of $1,500. So that's $18,000, almost a tenth of the $200,000 that I've helped people save, or at least that they're going to save next year. Now, on another, I found that a person's 2021 plan was changing, and it wasn't going to cover one of their medications next year. So they were familiar with their current plan, they liked how it was working, and they didn't really want to change. But I ran the numbers just in case, and lo and behold, same plan, not covering the same medication the same way. Now, a different plan not only still covered that medication, but it did so at a better rate than the current plan does. Also, I found out that the pharmacy across the street from this lady was going to charge her even less for it. And if she doesn't like that experience, she can go back to her old pharmacy and will still be paying less than what she is now. For that lady, the savings was about $1,200 a month, or a little less than $15,000. Now, a third gentleman that I talked with, he had a medication that retailed at $2,050 a month. This one wasn't available to get in an injection at the doctor's office, but I found a free coupon on GoodRx that would give him the medication for about $40 per month. So that's an additional $24,000 in savings. Also, because he didn't need a plan to cover that particular expensive medication anymore, we were able to move him to something with a lower premium as well. So, my last example, this client had the most expensive medication I've ever seen since I've been working with Medicare people. A year's supply of that medication would be $160,000. And I said, man, there's not a coupon on GoodRx that's going to do this. And the doctor, he talked with his doctor, it wasn't available as an injection. But then I suggested that he talk to the pharmaceutical company as well. And he did, he called them up, and they made a separate agreement to provide their medication to him for $5 per month. Now, most of my clients don't have experiences as extreme as these. My point is that people don't know what they don't know. And I help anybody with Medicare to make an informed decision and to get the product that best fits their needs. Later, if there's a problem or question, I'm there to help you remember how it all works and to help advocate for you as needed. So if you think this information would be helpful, give it a like to bump the algorithm and a share to get it in front of others. This is Nate Tate, Benefits by Design. My number is 913-633-4609. I'd love to help you with your Medicare stuffs. Have a good one.